Ticagrelor versus aspirin in acute stroke or transient ischemic attack. Aspirin, as known as acetylsalicylic acid, is a medication used long-term at low doses to help prevent heart attacks, strokes, and blood clot formation in people at high risk of developing blood clots. Low doses of aspirin may be given immediately after a heart attack to prevent clotting and reduce the risk of another heart attack or the death of the heart tissue. With regard to their effectiveness for the prevention of major vascular events, myocardial infarction, or death.
In the PLATO trial, which stands for Platelet Inhibition and Patient Outcomes, patients assigned to Ticagrelor compared with clopidogrel and who underwent CABG surgery had significantly lower total and cardiovascular mortality. Now in JACC, there is more detail on the differences in specific causes of post-CABG deaths. In the 1,261 patients with CABG performed within 7 days after stopping study drug, reviewers blinded to treatment classified causes of death into subcategories of vascular and non-vascular and specifically identified bleeding or infection events that either caused or subsequently contributed to death. They found that numerically more deaths occurred in the clopidogrel versus the ticagrelor group related to myocardial infarction, heart failure, arrhythmia, or sudden death, and that there was more bleeding in the clopidogrel group, including hemorrhagic stroke. Clopidogrel was also associated with an excess of non-vascular deaths related to infection. Among factors directly causing or contributing to death, bleeding was more common in the clopidogrel group compared with the ticagrelor group. The take-home message here is that the mortality reduction with ticagrelor versus clopidogrel following CABG in the PLATO trial was associated with fewer deaths from cardiovascular and bleeding complications. It sounds to me like ticagrelor may well be the drug of choice for patients after coronary artery bypass graft surgery. I'm Peter Block, and this is a CardioSource Heart Minute.
Applications in medicine. The FDA indication for ticagrelor is reduction of the rate of cardiovascular death, myocardial infarction, and stroke in people with acute coronary syndrome and or history of myocardial infarction. This trial was designed to compare ticagrelor with aspirin.
Aspirin has several effects on the body, but the primary uses are for 1. Anti-inflammation, fever reduction, and pain relief, and 2. As a blood thinner. Both sets of actions are caused by aspirin irreversibly deactivating a group of enzymes called cyclooxygenase, or COX for short. After an injury, inflammation occurs as part of the body's normal healing process. Inflammation is regulated by specific enzymes, mediators, and cells, such as white blood cells. COX is one of the key enzymes involved in the inflammation process. COX acts upon arachidonic acid, a fatty acid, and converts it into prostaglandins, which are small compounds that act as mediators of inflammation. Aspirin chemically reacts with COX irreversibly, disabling the enzyme and halting the formation of prostaglandins. Reduced production of prostaglandins in turn reduces inflammation. In normal blood vessels, after a stimulus such as injury, red blood cells often clump together as they travel through the bloodstream. This clumping action is an important element of the clotting process that helps stop bleeding after a cut. The clumping behavior of the cells is regulated by small cells called platelets. Like in inflammation, COX acts upon arachidonic acid and converts it into thromboxane A2, a compound that regulates the clumping action of platelets, in turn forming a blood clot. When aspirin deactivates COX, it shuts off the production of thromboxane A2, which in turn stops the platelets from aggregating red blood cells. If red blood cells don't form clumps, blood becomes thinner, which can reduce the chance of a heart attack, but also can lead to excessive bleeding.
Ticagrelor is an effective antiplatelet therapy for patients with coronary atherosclerosis disease for the prevention of thrombotic events and might be more effective than aspirin in preventing recurrent stroke and cardiovascular events in patients with acute cerebral ischemia of atherosclerotic origin. Of ischemic stroke is limited. Even with the aspirin treatment, the rate of recurrent stroke is 10 to 50% in the first 90 days, and the rate of new ischemic events when the aspirin is used in long term is only 22%.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via two major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow. In contrast, during a hemorrhagic stroke, abnormal bleeding disrupts normal blood flow. For example, in an intracerebral hemorrhagic stroke, a blood vessel bursts, spilling blood directly onto your brain, while robbing the intended tissue of nourishment. Both the hemorrhage and ischemia destroy brain tissue. A subarachnoid hemorrhagic stroke occurs when a weak spot in a blood vessel wall, called an aneurysm, bursts and leaks blood into the tight space between your brain and your skull. The high-pressure bleeding results in serious damage to brain tissue. Immediate treatment for your stroke may help to minimize brain cell injury and death. If you have an ischemic stroke, you may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke. In the case of hemorrhagic stroke, emergency surgery may be necessary to repair damaged arteries or reduce the pressure of the blood on your brain. You may be given medication to help the brain's blood flow return to normal.
Pros and cons. Ticagrelor is a potent antiplatelet agent that reversibly binds and inhibits the P2Y12 receptor on platelets, and it's a directing acting in contrast to clopidogrel. The benefit of aspirin in the secondary prevention.
So I'm presenting here is a subgroup analysis of the Plato study. So just to give you a background, the Plato study tested the hypothesis that a more potent P2Y12 receptor inhibitor, Ticagrelor, was more effective than clopidogrel in reducing the composite of death, MI, and stroke in patients with acute coronary syndromes, a broad patient population. And in that study, prior intercerebral bleeding was a contraindication for the study, but patients with prior stroke or TIA were accepted in the study. And that is a very important patient population because it's a patient of high risk of ischemic events and bleeding events. And this population is fairly large. It's more than 1,000 patients. They have clearly a higher risk of all events that we recorded, mortality, the primary composite, all ischemic events and bleeding events, of course, as you would expect. But interestingly, when we look at the randomized treatments, Ticagrelor versus clopidogrel, there were very favorable trends for Ticagrelor. There was a consistent benefit of the primary reduction of the primary composite endpoint, consistent with the overall trial. There was a consistent reduction in cardiovascular mortality and overall mortality, and there were no trends towards increased bleeding risk in these patients, neither overall bleeding risks or intracranial bleeding risk. So it seems effective also in this high-risk population, and it appears to be safe. And my conclusion is that if indicated, patients with
So one thing we know for sure is that after a patient has had a heart attack or stroke, aspirin decreases their risk of having a second heart attack. For those patients who have never had a heart attack or stroke, it's important to talk about your risk of heart disease with your doctor, and they can help decide, is aspirin right for you to prevent your first heart attack or stroke?
Issue applying in Ecuador. The World Health Organization considers cerebrovascular disease as one of the main causes of morbidity and mortality in the whole world, being considered a preventable cause of death with a high social and economic burden disability. In Ecuador, there were 3,777 deaths due to cerebrovascular disease in 2014, being the fourth cause of death in men and the second in women. Conclusion: transient ischemic attack is one of the main diseases and the one with the greatest economic burden, so it's appropriate to make aware the population about the importance of an immediate treatment and recognition of the instability of the disease.